Hi, everybody. This is Dr. Britt Daniel, MD, a neurologist and headache doctor, and today I'm podcasting about the subject of how much caffeine is too much. Discussion about caffeine is common for neurologists and headache doctors. The patient may present in the office complaining of frequent severe headaches while carefully cradling in his or her lap a grande 16-ounce Starbucks latte, which has 550 milligrams in it. So neurologists and headache doctors are called to educate and recommend decaffeination to many patients on a daily basis. How much caffeine is too much? Standard dietary guidelines suggest adults without migraine may consume up to 400 milligrams of caffeine a day as a maximum dose that may be taken without affecting a person's general health. This is equivalent to around 3 to 5 8-ounce cups of coffee a day. Advice here should balance between persons with migraine and others without migraine. Migraineurs, that is, persons with migraine, should take only a small amount or no caffeine. Adolescents shouldn't take more than 100 milligrams of caffeine per day. Pregnant women should limit daily intake to less than 200 milligrams of caffeine per day. The effects of caffeine on a baby are not well known. What constitutes a safe amount of caffeine differs from everyone based on age, weight, and overall general health, and whether or not they have inherited the migraine gene. Persons taking more caffeine from the table listed below may suffer from caffeine overdose. Oftentimes, the same patient may be taking several Excedrin migraine tablets a day, and those tablets each have 65 milligrams of caffeine in them, and an accurate caffeine count should be done for every headache patient by the doctor. American Migraine Society articles have stated that caffeine is the number one drug in America that causes medication overuse headache, which is the diagnosis in 80 to 90% of new patients to a headache practice. So, related questions. What's the usual source of caffeine? Well, I have a big table which I'm not going to go through individually, but it's on my webpage at drmigraine.com. I'll just say, like I said at the beginning, a coffee Starbucks Grande, Starbucks 16 ounces, 550 milligrams of caffeine. That's a lot. Excedrin, each tablet has 65 milligrams. Coca-Cola, 12 ounces, has 32 milligrams, and so on. Caffeinated drinks such as, coffee, tea, cola, chocolate, food, candies, and energy drinks all exist. Without workout supplements for enhancing exercise performance can have caffeine in it. Also, cold and flu tablets have caffeine in them. Caffeine supplements in tablet or powder form. I have really usually more caffeine than coffee, and people can find it hard to measure just how much they have taken. Caffeine powder is very dangerous and can contain between 3,200 and 6,400 milligrams of caffeine per teaspoon. That's a lot. The FDA warns against the use of these products due to their potential to cause serious health consequences. And I have at the end of this talk a case report about somebody who used that. Caffeine occurs naturally in plants, nuts, and seeds, and manufacturers add it to some foods and drinks. Caffeine is a bitter substance. Just think about what black coffee tastes like. It occurs in more than 60 plants, including coffee beans, tea leaves, cola nuts, which are usually used to flavor soft drink colas, cocoa pods, which are used to make chocolate products. Synthetic caffeine, which may be added to medicines, foods, and drinks. For example, some pain relievers, cold medicines, and over-the-counter medications for alertness contain synthetic caffeine. So do energy drinks and energy-boosting gums and snacks. Is caffeine a drug? Well, the current edition of the Diagnostic Statistical Manual of Psychiatry Diagnosis, the DSM-5, dated 2017, added a new drug to the list of well-known addictive drugs, caffeine in amounts as small as 120 milligrams a day. The criteria for caffeine withdrawal are prolonged daily use of caffeine, abrupt cessation or reduction of total caffeine use, closely followed by headache and one or more of the following symptoms: fatigue or drowsiness, anxiety or depression, nausea and vomiting, significantly clinically induced distress or impairment in social, occupational, or other important areas of functioning. Caffeine may affect the body at a rate of 15 milligrams per liter in the blood. A concentration of 80 to 100 milligrams per liter can be fatal. What is caffeine overdose? Well, the symptoms are diagnosis for this means you have to have an overdose of certain amounts of caffeine in excess of 250 milligrams a day, and then the development of 5 or more of the following signs during or shortly after caffeine use. So the symptoms are restlessness, nervousness, excitement, insomnia, a flushed face, diuresis, gastrointestinal disturbance, muscle twitching, rambling, flow of thought and speech, tachycardia, or cardiac arrhythmia, periods of inexhaustibility, or psychomotor agitation. Caffeine overdose is more likely from taking a dietary supplement than by drinking coffee. The pharmacology of caffeine. Caffeine acts as a central nervous system stimulator, a point that's well made by the coffee ad on TV, which calls it the think drink. Caffeine increases some of the body's processes. With caffeine, consumption messages moving between the brain and the body can travel faster. This is one reason why a person may feel more alert or focused after consuming caffeine. Caffeine acts as an appetite suppressor. The duration of the effect of the drug is 6 to 8 hours, but even one drink in the morning will interrupt nighttime sleep in some people. Caffeine acts as a constrictor of smooth muscle, which is found in arteries, the bladder, and the colon. It is the arterial vasoconstriction action, which helps with mild migraine, such as using Excedrin, BC powder, or Vivactin, and may lead to the rebound vasodilatation headache when one withdraws from caffeine. The smooth muscle effect also acts as a mild stimulator on the bladder, promoting urination, and in the colon, a bowel movement. The symptoms of caffeine overuse are dizziness, diarrhea, increased thirst, insomnia, headache, fever, and irritability. Serious symptoms of caffeine overdose, those really big symptoms are trouble breathing, vomiting, hallucinations, confusion, chest pain, irregular or fast heartbeat, uncontrollable muscle movements, convulsions. Medical problems aggravated by caffeine overuse are generalized anxiety disorder, insomnia, panic attack or panic disorder, gastroesophageal reflux disease disorder, and it's called GERD, migraine or medication-induced headache, epilepsy, death, rarely. Who should avoid or limit caffeine? Well, pregnant women, since caffeine passes through the placenta to the baby, breastfeeding mothers, a small amount of caffeine goes to the baby, persons with sleep disorders and insomnia, migraine or chronic headache patients, patients with anxiety, patients with gastric reflux or ulcers, patients with fast or irregular heart rhythms, patients who have high blood pressure, patients who take certain medications or supplements, including stimulants, certain antibiotics, asthma medicines, and heart medicines, children or teenagers who are very sensitive to caffeine. The treatment of caffeine overdose. Advice regarding accidental poisoning is available from the Poison Control, a not-for-profit organization, which is online or available for chat. You have to call 1-800-222-1222 or get help online at www.poison.org. Do sequential blood caffeine levels follow the course of treatment? Use activated charcoal, which is commonly given in the ER, for drug overdose and which prevents caffeine from being absorbed in the GI tract. Give Epicac, which causes vomiting and elimination of caffeine from the body. Use gastric lavage by putting down a GI tube and wash the caffeine out of the stomach. Use beta blocker drug treatment for cardiac arrhythmias and hypertension. Monitor blood pressure, pulse, and EKG while you're in the ER. What's the frequency of caffeine overdose? Well, in 2016, Poison Control Centers in the United States had 3,702 caffeine-related exposures in children and adults. 846 of these cases required treatment at a medical facility. There were 16 major outcomes from caffeine overdose. Several caffeine-related deaths have been reported. Caffeine overdose is most likely result from taking a dietary supplement or caffeine tablets rather than from drinking coffee, especially when people combine these products with energy drinks, sodas, or coffee. Supplements increase the risk due to having higher levels of caffeine than foods and drinks. Unlike drinking coffee or even taking supplements containing caffeine, using purified caffeine powder is highly dangerous and much more likely to cause an overdose. The United States Food Administration warns that a teaspoon of powdered caffeine can be equivalent to 28 cups of coffee. It stresses that pure and highly concentrated caffeine products can have serious health consequences. The cause of death from caffeine overdose is typically ventricular fibrillation. This condition happens when the lower chambers of the heart vibrate rather than contracting regularly. Ventricular fibrillation stops the heart from beating normally and causes cardiac arrest. The fetus or newborn is unable to break down caffeine quickly. The American College of OB-GYN advised women who are pregnant to limit their caffeine consumption to less than 200 milligrams per day, which is equivalent to 1 to 2 cups of coffee. For women who are breastfeeding, the Centers for Disease Control and Prevention, CDC, state that a low to moderate intake of coffee should not affect a baby. The impact caffeine and stimulants on children and adolescents is uncertain and is the reason why the American Academy of Pediatrics has stated that children and adolescents should not consume caffeine. Technokinetics. Caffeine is rapidly and nearly completely, up to 90%, absorbed by the stomach, with peak plasma concentrations occurring within 20 to 40 minutes. Toxic levels can be reached quickly and last for prolonged periods of time, secondary to caffeine's 3 to 10-hour half-life. The liver metabolizes caffeine via N-demethylation, acetylation, and oxidation. Other substances that use these same pathways, such as alcohol or medications, can prolong the half-life of caffeine by approximately 72%. And at the end of this talk, I have a comment about a man headline in News Corps published Friday, the 29th October 2010. Headline was, "Man Dies of Caffeine Overdose, Case History." A British man died after poisoning himself with 2 spoonfuls of caffeine powder brought over the internet, local media reported Friday. Mr. Bedford from Mansfield, Central England, was at a party in April when he swallowed caffeine powder that a friend bought online. He washed the powder down with an energy drink and around 50 minutes later began sweating and vomiting blood. He later died at the King's Mill Hospital in Nottinghamshire, Central England. The court heard that Bedford ignored the product's recommendation to take more than 1/16 of a teaspoon and instead took 2 spoonfuls of the powder, ingesting a level of caffeine 70 times more than is usually found in a high-energy drink. Speaking outside the court, Bedford's aunt Sue Burton said, quote, "I think there should be a warning on it saying it could kill," end of quote. Nottingham coroner Dr. Nigel Chapman said, quote, "Caffeine is so freely available on the internet for £3.29, but it's so lethal if taken in the wrong dose, and here we see the consequence. So many people are upset and distraught by the death of this man." He also criticized the product, which was not named in the inquest, for recommending such a small dosage which could easily be ignored. Who would take 1/16 of a teaspoon? It's such a small dosage. The warning is so small on the front of it, Chapman said. And if you're carrying a bag around of it, you hadn't seen the warning, it could be that anyone at the party could have taken it. It's so dangerous to take something like this. He recorded a verdict of accidental death. So it's the end of my talk on how much caffeine is too much. Hope you've learned something from this. Please click on subscribe so we can follow each other. And please follow me on Podbean or Spotify for other pod talks I have, or you can go to my webpage at www.drmigraine.com. God bless all you persons who have migraine, and I will see you on the next talk.